Hello, 8th District family and beyond. Thank you so much for tuning in to our final series, Health and Safety, in our virtual town hall series. So thank you all so much for joining us. I am going to bring up a slideshow presentation and we're going to get started. All right. There's me on a good day. All right, so who am I? I am Amy Wentz. I am running for city council here in the city of Richmond in our 8th district, South Side, which encompasses the Route 1 corridor, much of Walmsley Boulevard, Broad Rock, and the McGuire area, and then also neighborhoods outside of Southside Plaza. I am super, super, super excited to have been to be creating these town halls. We have done now 5. This is our 6th one. And the topics of education, infrastructure, growth, housing, transportation, and now health and safety. They have been, there's been tremendous support and tremendous engagement around these topics. And so I'm super excited to be able to do this with you all. Going to the next slide. All right, so yes, talking about our previous town halls, if you missed any of them, you can watch them on in the video section of the Friends of Amy and the 8th Facebook page. You can also watch them on our YouTube channel, which is www.youtube.com/Amy and the 8th. And that's 8 with the number 8 sign, number 8 TH. You can watch them anytime. Just go back and check those out. So we invite you to do that with us. And now we'll get into the topic of the night tonight. So first, we're just going to talk about health, and then a little bit later on, we're going to talk about the safety portion. But the health and safety of Richmonders is affected not only by the education and income of individuals and their families, but by the neighborhood and environment in which they live. And so when we're talking about the health of the 8th district, you know, some of our neighborhoods are really suffering from some of our worst conditions when it comes to health outcomes. Therefore, wellness initiatives are aligned to infrastructure of the 8th district and its residents' ability to readily access the varied services that promote healthy and happy lives. And what I mean by this is that we want to make sure that all of the things that we've talked about so far, okay, anytime we're doing initiatives and growth and infrastructure, that we're always thinking about health and the health of 8th district residents. All right, so how do we do this? The first thing, health equity. Much of the early stages of building equity into holistic view of health comes on the heels of investment in infrastructure and effective planning. The land use around the needs of the communities that are served. And what does that mean? That means just like what we were talking about, are our neighborhoods walkable and bikeable? Are the community resources that we need to be able to access readily available to us? Do we have equitable access to those services? Also, increased funding for public spaces, pedestrian infrastructure, and facilities address many of the suggestions from the health equity organizations as outlined to follow. So we're going to go through some of those now. First, support development of facilities in underserved communities. And what we mean by this is, you know, many healthcare organizations plan their development based on the desire to capture market share, increasingly building new hospitals in very affluent neighborhoods. Incentivizing developments in the 8th can positively impact health inequity by making healthcare available to underserved patient populations. If you're from the 8th district, you can probably count on one hand the amount of health access to health practices we have in this area. We are the furthest geographically seated district that's away from a hospital. So you have to either bolt up Chippenham Parkway to go to access Chippenham Hospital, or you have to head into downtown to access MCV. And so we know that it's hard to find doctor's offices, optometrists, dentist office, et cetera, in this district. So just really working on how we can incentivize the development of those types of resources to come to this area that that drastically needs it. So that's number one. I have two screens, y'all, so bear with me while I look on one screen and come back to you. The next one, require a diverse pool of contractors and suppliers for new development. So supplier diversity efforts can positively improve the economic health of communities. And this has been done in other areas. And so one of the things that we were looking at is Kaiser Permanente Supplier Diversity Initiative. They provide minority-owned, women-owned, veteran-owned, and small businesses the opportunity to participate in contracting and subcontracting activities. And so that is a health organization that is committed to ensuring that members of the community are an active participant in all aspects of how they're developing healthy spaces. Let me, I'm gonna pull over to, here we go here. And this is just a little brief, their commitment to the supplier diversity. That's something that we could also be mirroring here in the city of Richmond. And so I'll drop this link. You want me to, let's see, how can I do that? Maybe I won't drop the link. You all can see the link here at the top. But the mission is to ensure that dollars spent contribute to economic and environmental health and reflect the diversity of the communities we serve. And so that is the type of commitment that we're looking for when we're partnering with organizations that could come into the 8th and help us with this strategy. And so use a comprehensive approach to supplier diversity to create community wealth, generating sustainable jobs and work opportunities, and support the development of businesses that can spur economic development. And we'll talk about that another time, because I like the term community development, because we always know that community needs to be at the table for everything that we do, especially over here in the 8th. And then development to help create better health outcomes in the communities we serve. So I'm going to move back to my slide, but these are the types of initiatives that I would be supporting, that I would be working to partner with. And so just so you know where I stand on certain things. The next is investing in infrastructure. Let's see, this came down. There we go. All right. So like we talked about before, we want to make sure that we're revitalizing, maintaining, and increasing the number of community spaces in the 8th. And so I think part of the 300 plan, they really want to focus on ensuring that within a certain amount of miles from everyone's home, that there is access to a public green space that people can go and they can have recreation and just help to lead healthier lives. And so parks, walkable trails, etc. And we know from our infrastructure town hall that we had here that the 8th district is really ready for that. We are ready to have additional spaces like that. Right now, we're very limited. Even though geographically we're the largest district, we're very limited to the amount of public spaces that we have access to. And that's just really unfortunate. And that would be something that I'll be working to change. And let's see. All right. And the other thing that that other initiatives, and let me see which state did this. I believe it was Minnesota. So this was done in Minnesota. So basically mandating collection and annual analysis of health care equity data. So it's not just gathering health data, but making sure that there's an equity lens on it. And so in 2011, Minnesota started requiring healthcare providers to collect race, ethnicity, and language real data. The inequities revealed by this data motivated Allina Health, a not-for-profit or healthcare system serving communities throughout Minnesota and Western Wisconsin, to take targeted actions to reduce inequities for some of its racial ethnic minority patient populations. And I'll just say too, that we also, VCU Health Systems, which I have here, I believe. Yeah, they actually did a RVA health equity report. And so I'll also later drop the link into that so that you can kind of see some of those things, but I'm just going to point out some of them to you. We talk about African Americans having higher rates of infant mortality, okay? Coronary heart disease mortality, preventable hospitalizations, HIV infections, hypertension, teenage pregnancy and childbirth, homicide. And then our Latinx community has higher rates of uncontrolled hypertension, teenage pregnancy and childbirth, and inadequate health insurance coverage. And then our Native Americans have higher rates of motor vehicle accident mortality, suicide, HIV infection, binge drinking, and tobacco use. And so with those health disparities needs to be intentional coverage, and so that we can have strategies towards minimizing that. I will say that it's full of data here that just talks about, I think there was, let's see. There was some, okay, you know what? I'm going to go back to the insights report. So let me, I'm going to pull up the insights report here. So as a part of the Richmond 300 process, you all know I was on the Economic Development Working Group. If you have watched any of the previous town halls, there was a document called the Insights Report that kind of just gave an overview of where Richmond stands in like so many different areas. And one of the things that was really alarming and concerning was this public health section. And so I want to zoom in a little bit so that you all can see what I'm talking about here. So as you see here, where you live in Richmond determines your health and life expectancy. Analysis by the VCU Center of Society and Health shows that life expectancy ages range from 63 to 83 years for city residents, right? And so we're talking about fitness class, access to fitness classes, 40% of Richmonders living in food deserts, overweight and obesity rates increasing. 1 in 8 Richmonders Richmonder adults have diabetes. Asthma rates are varying based on geography, and I'm going to show you where those are higher, which is very alarming. Richmonders using tobacco, more Richmonders use tobacco than Virginians total. And then the culture of health. So we don't, yeah, there was an award for recognizing collaborative efforts about organizations, but I want to talk about this right here, this map on the side here. So let me go a little bit bigger. So if you, and we talked about this in one of our other town halls, but if you see this, right, this is the life expectancy, the health opportunities index. And if you notice the colors here, highest, high, middle, low, lowest. And so the lowest, okay, 129,690 Richmonders, which is 60% of the population, okay, have the lowest health opportunity index score. And that, if you see where we are, okay, this is Broad Rock here. Can they see my mouse? Let me see if it comes up on the thing. I don't know if you all can see it or not, but basically that bottom portion, okay, South Richmond, that's us. And so we make up that section of Hull. Maury is right there, Hopkins Road, Belt, Broad Rock, all of that section there encompasses the 8th district. So this just shows you, you know, the emergency situation we're in when it comes to health. Like, this is showing us that if you're talking about life expectancy between 63 years old and 83 years old, when you're in these areas that are shaded in the lighter color, you're more likely to pass away earlier than people who live in areas that have darker colors. I don't know how else to explain that this is a state of the, you know, this is a situation where all hands on deck should be, you know, approach should be attached to this. And I say that because, you know, I just want folks to understand that if we're not, you know, and this is candidates running for office in any, you know, election, if you're not really assessing this data and really talking about the issues and making sure that we're working on solutions, then you're kind of implicit in our state of affairs, and it's not a pretty sight. So to show you all that, and then also down here, actually we'll go back to that, but I want to show you this about sustainability and resiliency too. There was an article that came out last week in the New York Times that just talked about our heat-related illnesses and the heat shield and the urban heat vulnerability maps here in the city. And I just want to again show you our district here. You know, you have the highest in vulnerability, high, moderate, low, and lowest, and you'll see how, you know, there's a lot of areas also in Northside and in the East End as well. But we're talking about Southside and we're talking about the 8th District. And you can see that there are a lot of our areas. And here we are right now on Route 1 corridor where my office is. We're at 3501 Route 1. And we're right in a zone that, that has some of that higher shading of red there. So we just want to make sure that we are, and there was some exciting news today about tree planting and some grants and stuff that are going to be coming our way soon. But just to know that this is a situation, that we're in. And so we just really need to be actively working to come up with solutions on this. So this is why we're doing this town hall. Okay, so let's see. We pause to talk about that. All right, and then now we're gonna just talk about the impact a little bit about some of those initiatives. They were able to mail patients home testing and screening kits for things that they needed. They were also able to use culturally tailored education materials, instructions and FAQ documents written in the patient's primary language. They were also able to provide care guides that connected patients with to address barriers, including non-medical challenges like lack of transportation, which is another issue that we have here, to increase patient understanding of screenings, goals, and options. And they were also able to harness the power of the community via social media campaigns that better engage African American and Spanish-speaking patients, which we all know the 8th District is a primarily African American and Spanish-speaking district. Also using analytics, okay? Guess who's an analyst by trade? Hey. To monitor effectiveness and interventions on populations at the highest risks for the poorest screening rates, which we saw from the Insights report, as well as the VCU report, that this area, the 8th District is one of those places that is at the highest risk. So with that said, things will and can get better. And you know how I know that? Because we have amazing, amazing, amazing Richmonders that are really committed to ensuring that that Richmonders are healthy and that are happy. And we're going to bring them on now because I have some guests that I'd like to introduce you all to. And we're going to be talking about solutions. So that is what's popping. Hey, Courtney.
Hi, Amy.
All right, we're going to pop everybody else in. Hey, Dr. Joe.
Hey, y'all.
And hello there, Mecca.
Hey.
So listen, I was just, and I'm sure that you all saw backstage, just kind of giving an assessment of kind of where we are in the 8th District as far as our health outcomes are concerned. And, but we just want to make sure 8th Districters know that there are amazing people right here in our community that are doing really good work to try and combat those. So I'm just going to, starting with Courtney, then Mecca, then Dr. Joe. I'm just gonna ask you all to introduce yourselves and the organizations you're representing. Oh, and before you start, just want to let everyone know that their presence in this presentation, they are here as subject matter experts. They're not here to endorse my candidacy or any candidacy. And I'm sure that they would be open to doing town halls with whoever asked them to, because at the end of the day, it's about creating better health outcomes for Richmonders. And so just want to make sure that that's clear. It's not an endorsement. They're appearing as subject matter experts. But Courtney, by all means, go ahead and introduce yourself.
So hi, everyone. My name is Courtney Glenn. I am a doula and childbirth educator. So what that means is I work with pregnant people, families, and communities to support the pregnancy experience and what we call the perinatal year. So from the time you know you're pregnant until for any particular period after you have the baby that you feel like it's important for you to be supported. So particularly about that first year of the child's life, I am there to support you. I am one half of the Remedy, a doula duo, and we work together as Remedy Birth Services to educate, advocate, and change birth outcomes. A lot of people have heard recently about the maternal and infant mortality rates, particularly here in America, but primarily for Black women. We have a crisis on our hands, and there are so many people doing work around Richmond and Virginia, around this country, to help advance our issues, let people know we have a problem, and we're on the ground working to fix it.
Thank you so much for joining us tonight. Mecca.
Hey, so I'm Mecca Williams. I'm a licensed professional counselor. I work as a therapist in a addiction rehab facility. And I'm here to support the cause because I live in the 8th district and I'm aware there's not a lot of resources for mental health or addiction. It's like one facility up the street from me, but it's all for all men. So we don't have any co-ed facilities. There's not a lot of resources for mental health. So I'm here to help.
All right. Well, thank you so much, Mecca, for joining us. Dr. Joe, your turn.
It's so nice to meet you three powerful leaders. I'm Joe Fields Johnson. I'm a family physician. I grew up in Richmond. I just returned back to Richmond after being away for a long time. And I, as a family physician, I'm an expert in the complexity of family health and individual health throughout their lifespan across life transitions. And I really am excited to be integrating, being connected to all the real roots of health that affect everyone's lives that Amy was really referring to in the introduction to this discussion we're having. It's really at the heart of family medicine. We really talk about the social determinants of health a lot, and what I can do in the exam room is, modest, but what we can do as communities as we come together and work hard to shape people's lives is really where the heart of the good work to help change health outcomes is. So I'm happy to be part of this conversation. I'm just starting a clinic right on Hull Street, just 2 blocks from the 8th district, and over in Blackwell. And I'm super excited to be here and share more.
Thank you so much for joining us, Dr. Joe. So I just have a round of questions for just one for each of you. And then wherever the conversation kind of takes us, I'm fine with it going there. But the first question was for you, Courtney. And, we have been following state legislation, and we know that there's been a real insurgence of just help and support for birth workers. And so we're kind of excited about that. I know that there are some things that you all really want to, in the next session to get passed. But anything you want to say about policy that's elevating birth workers, and then also as a second little part to that, if you can talk about your organization and what great things that you'll be doing here in the 8th district too.
So sure. So a lot of people do not know, so I'm a doula and a CBE, but my professional background is in government and policy. So that's kind of my first love. Birth is my first love, policy is my second. So I really had the privilege to have conversations and work along some of our state legislators as they really pushed for legislation that's going to change birth experiences for people throughout the Commonwealth. So at the end of last year, the governor issued a mandate basically saying that he wanted to eliminate racial disparity in maternal mortality by 2025. So we really have like 4 years left. It's an aggressive goal, but if everybody's cooperating, if communities are working with our legislators and healthcare systems are willing to assist us, this is something that Virginia can work towards. Absolutely. So what he did is he increased funding for access to contraception, which a lot of times people are like, well, you're pregnant. Why would we talk about contraception? But after you have a baby, we need a plan. If you're not interested in growing your family again immediately, we need to talk about how contraception really affects your entire life, whether it helps you with childcare or, you're concerned about your employment and managing more than one child and the cost of childcare. So these are all issues. I like to tell people that pregnancy is really a community issue. It affects everybody. It affects kids, parents, grandparents, teachers, everyone. So there's not anyone in the community that is unaffected by a pregnancy. Also, there has been some money allocated to start home visits, which helps people navigate all of the healthcare system. So a lot of times, and they're getting away from this, but for people who have had babies, I would say over the past 20 years, you have your baby and then they say, we'll see you in 6 weeks. Well, what sense does it make that we see you in 6 weeks, but the baby has to be seen by a pediatrician in 2 days? Your body, your mental health, your emotional state, and your physical care is primary in caring for this newborn. And a lot of pregnant people die in that first year because there are gaps in our care system. So community health workers will stop by your home, maybe let you get a nap, rock the baby, check to make sure you all have enough to eat. Do you guys have transportation to your medical appointments? Are you a little swollen? Do we need to contact your doctor about possible preeclampsia even after birth? Those are all things that can happen when you have someone checking in on you. So money to fund those kind of initiatives is going to be so helpful for people, pregnant people, and those in their childbearing age and having children right now. That I would say we as birth workers and a birth community are really pushing for is the development of what we call a Medicaid reimbursement model. So a lot of people don't know this, but so goes Medicaid, so goes private insurance in whatever state, commonwealth, jurisdiction you're in. So if Medicaid will fund doulas and say, hey, you guys are doing great work, it increases outcomes, we have lower C-section rates, which lowers our costs, because let's be real, for a lot of government officials, the dollar is the bottom line. And if that's the language that I have to get you to speak to the cause, that's what we'll do. But if we can get Medicaid to reimburse us for the work that we do, then private insurance will have to create create some parity. So we want birth support, birth workers, doulas, lactation consultants. We want every support system for the family to be available to everyone. So we need people to contact their state legislators, their state senators. Reach out to these people. You can call their number. They're in special session right now.
Just to tell everybody from the 8th District, our representatives are Betsy Carr and Joe Morrissey, Senators Joe Morrissey. So
yes,
make sure you write that down.
Reach out to them. Tell them that this is important to you because you know how pregnancy affects an entire community. So, we have lots going on from a legislative perspective, but also, and Amy tried to slide it in. I know for me personally, my long-term goal is to create more birth support access in the 8th District. I envision a space where people can come and be educated about their bodies. People can come and have access to contraception. People can come and not be judged for that, whatever choices they're making, but to get evidence-based care and information. And ultimately, we want to have a birth center, but not just to have your baby there, but to be like a community hub where people can come and learn and be educated, exchange information, parenting classes, all of that right there in the 8th. There is such a need in our communities for this, and we're consistently overlooked. So rather than waiting for someone else to come solve the problem, we're going to build and handle it ourselves.
That is amazing. Okay, I cannot wait to just hear about your progress on, achieving that goal. And you already know anything I can do to help make that happen, I will do. I've been, searching for locations and just looking around, but I'm so thankful for that. That is great. My next question is for Dr. Joe. And in today's climate, it just seems like the standard medical practice, as we know it today, is just not as fluid as we'd like it to be. As patients, tell us about your future practice that borders the 8th and what services you all will be bringing to the area. And I just want to tell a personal story. One of the reasons why I invited Dr. Joe to this town hall, and I just have so much respect for him, is you all know how important I feel like community development is. And community development is when, you are working directly with the community on the things that they need and want, and not just creating a plan and plopping it on a community. So Dr. Joe, I met because he reached out to me in an effort to kind of do a tour of the 8th District. He's a Richmonder, so he's from here, but just kind of doing just a deep dive into our areas and see, scouting locations for his practice. So I'm so thankful that he is in walking distance from us. And so go ahead and talk about it, Dr. Joe.
I really enjoyed riding around the 8th District with you and becoming acquainted with it. I'm new to the south side of Richmond, and I came here mostly because of my philosophy of family medicine and really wanting to bring services where they're critically needed. And a big piece of that was this model of care that I'm using. It's called direct primary care. Many people are familiar with their primary care services they get through their insurance, or maybe, at a health center or potentially a free clinic. But the services I'll be providing are from a family physician, that's me, and it's a membership model. So many people don't have access to care because it's too expensive, not accessible, and they have to wait for months to actually get a visit, even if they have insurance. But too many people are uninsured, especially our Latinx community in Southside. I'm bilingual and Spanish speaking. So many of those adults especially cannot get insurance because of the work they have or their documentation status. And that's just one of many communities that has difficulty accessing high quality care. So through this direct primary care model, it's a monthly membership fee. I can spend as long as my patients need me to spend with them. If it's 30 minutes, it's an hour, if it's longer, to really understand the context of their life with dignity, in context of the 8th district or wherever they're coming from, and then develop a plan together with their values centered. And there's no co-payment for those visits. They can be in person, by phone, by video. And I'll even do home visits for people who are homebound, for either because of their disability or because of newborns, because they've been delivered at Courtney Glenn's beautiful birthing center that's going to be in the 8th. And I'm just living that dream. I love it. I do newborn and women's health care. Do that dyad together and caring for both, and doing home visits like you were describing with community health workers specifically is shown to really help those health outcomes dramatically. And to caring for both as a unit and not separately, and the ways that mothers want it, is really critical. And so my clinic model is to really build dignity, accessibility, and cost transparency. So I have access to very low cost lab and medications, one through Hope Pharmacy, a local pharmacy in town, but also just through other
Black and women-owned pharmacy.
I love it.
Wow.
And so building those collaborations and supporting those networks that are developing to care for people is really critical. And so that's kind of the general model, and I can go into specifics on pricing if that's something that you're curious about. But it's really just to bring that real dignified, accessible care across the lifespan for families in the South Side.
So when we were closing, I'll have you each just say how people can connect with you. And then at that point, you can put you can plug your website and things like that. So transitioning a little bit from primary care to mental health support, Mecca, I'm so thankful that you're here with us today because, just with COVID-19 and I'm, being quarantined and isolation and just, not being able to hug and love on people like we want to. I know in the 8th district, we are huggers. Whenever I do an event, the first thing people want to do is just come and hug. And I'm like, stick my elbow out like, no, we can't hug. But, people just sometimes just need that, just that interaction. And so this the climate we're in, I'm noticing just a lot of more, depression is increasing and just the need for additional mental support. So can you share with us any resources that are available to city residents? I know that if specifically 8th district residents, they'll be able to utilize city services. And then how can they get the help that they need?
Okay, so first I want to address what's going on in the community with COVID. We have the racial tension, the protests, all that is playing on everyone's mental health. We're all affected by this, right? And so it's more increased depression, increased anxiety. There is increased addiction during this time because of the downtime. A lot of people have lost their jobs. It's a lot going on that's really affecting our mental health. Also, I want to just kind of say how mental health, the physical health, birthing, all that stuff is tied into. Because as far as birthing is concerned, the mental health piece comes in when you're dealing with the person that's suffering from postpartum depression or maybe postpartum just care, just checking and seeing where their mental health is, and all that stuff is related. Also, how the physical health can affect the mental and the mental can affect the physical. A lot of stuff that our physical is based upon stress and unresolved mental health issues. So as far as Richmond is concerned, as far as resources for help, so if you do not have any insurance at all, RBHA, Richmond Behavioral Health Authority, is the go-to hub that they provide psychiatric services, therapy mental health therapy, and case management service, addiction services. They have outpatient and inpatient addiction services. They have groups. So RBHA is the hub for anyone who does not have any form of insurance.
Okay.
If you do have some form of insurance, which would be Medicaid or one of the commercial insurances, if you're looking for a provider, I would recommend, whether it's a psychiatric provider or a therapist, going to Psychology Today. You can put in, decide, hey, I'm looking for a psychiatrist, therapist, or a group. And you can also break it down by your insurance and your zip code. Then they'll have a list of providers.
Okay.
BetterHelp is another resource that's online. Also,
you said BetterHelp.
Yeah, BetterHelp.
Mm-hmm.
That's for mental health resources too, just providers. Also, in our district, there is River City Counseling Comprehensive Services that they're on Hull Street.
Okay.
They're on 1012 Hull Street.
Do they have like a little garden outside and some multi? I think I know what you're talking about.
I don't know. I don't know.
That's okay. I'm gonna make a trip over there. And I do want to add, I know you were talking about before how we do have the healing place that helps support addiction on the side, but we do have the female healing place is about to be opening up. And from what I've been told, you'll be able to bring your children there if there's an issue with children. And they're doing some really good work over there to try to get that up and running. And that's going to be right off of this corridor. Matter of fact, up there by close to Maury Street. So that's
when they're opening up.
I mean, I think they're in the final stages now. I mean, I was over there at a neighbor's house, just, doing some canvassing, and they were putting up the final touches and bringing in the furniture. So I think that they're going to be opening up here soon.
Okay, so that's another place. I'm glad you mentioned, again, the Healing Place on Dinwiddie Avenue. That's a treatment facility for guys, a residential treatment facility that's struggling with addiction. And I guess they're going to open up the for women and children. That's awesome. Also, I am involved. I received a grant. I'm a grant recipient for Richmond Memorial Health Foundation, their Hearts grant. So in a component, I'm doing a lot of things in reference to mental health panels, community panels, things like that. But in addition to that, I've partnered with Avail Counseling, and they're offering 8 free therapy sessions with one of their interns, and they're going to be supervised by Tangi. What her new last name is Tangi Augustine. She just got married. She's an LCSW. So we just decided today that's going to happen, and that's available from now into December 1st.
Okay.
So for anyone, it's a criteria. I'm going to post it on my social media. So one of the criteria is definitely anyone who does not have any health insurance right now. So I think I'm excited about being able to be a part of offering that service. Just 8 free sessions to get people inundated and acclimated to the therapy process. Okay,
that is amazing. It's always great to hear about new resources. I try to, I'm a resource connector. I try to stay up on things, but it's just like daily new things are coming. So we definitely we're thankful for that Hearts grant and your ability to do that specifically over here. All right. So I'm also going to give you all, because we are going to go into a public safety portion of this, but I want to just give you all the opportunity to plug how people can connect with you, anything that you want to say that you weren't able to say before. Start with Courtney. We'd love to hear from you.
So I can be found at Remedy Birth RVA on Instagram. That's the doula services page. It is Remedy Birth Services on Facebook. And if you're looking for me, I am Future Baby Catcher on all platforms. My goal is to become a midwife, so that's why I'm a future baby catcher. But
I follow you already. I don't know.
Yeah, I think so. I follow you. I know that because I always love your fashion.
Thank you.
But yeah, so I can on social look for me and Keandre. Her name is Keandre B. Doula. She is my business partner. If you need birth support, if you want to talk to us, if we can't help you, we can refer you to other local organizations. Just let us know so we can say to them, hey, we're sending people your way. We all work together as a birth community. So know that there is support. And if you are pregnant or know someone who is, send them our way. We want to support people as they grow our community, bring new life into the world.
All right. So you all, I will definitely be posting how to get in touch with Courtney later, but thank you so much for joining us. We really appreciate it.
You're welcome. Thanks for having me.
No problem. All right, Dr. Joe, you're up.
I love that energy. So I guess there's two categories of people. One would be people who are just needing care. They need either they're uninsured or they're frustrated with their current care experience. So they can go directly to our website, dandelionhealth.com. And they can also go on social media. We're on Facebook, Twitter, and Instagram at DandelionDPC. That's like direct primary care DPC. On each of those. For me personally, I'm at JoeFJ on Twitter. It's probably the best way to, if you want to interact with me directly. If you are a member of our organization, I have pamphlets I can bring out to you guys. Just send me a note and I'll bring them to your business or to your community organization so you can pass them out to people to share the resource. And I also would love to hear about other people's resources that I can connect people to as I'm caring for people on Southside. I'm excited to join the community and contribute good work.
We thank you, Dr. Joe. We're super excited to have you as a neighbor. And as soon as you're up and running, we'll make an announcement.
Great.
So thankful that you are here with us today. All right. And you're up next, Mecca.
Okay, I can be found on Instagram at Mecca Presents with the S at the end, and Facebook, my name, Mecca Williams, and Twitter, Mecca Presents. That's pretty simple.
Yeah. All right. So listen, if you all just are in need of understanding more about birth services and birth work, please contact Courtney. If you just want to know about a new practice that's in our area, please reach out to Dr. Joe. And then Mecca, if you need help with any mental health supports, she can connect you with those, some of the services that she talked about today with Avail Counseling. And so we are so thankful to have you all on. I'm so sorry that it's just so short, but we try to keep prompt because they like it to be prompt. So when we say an hour, they want it to be an hour, but thank you all so much. And like I said, we'll be sharing your contact information and how folks can connect with you outside of this.
Thank you.
Thank you so much.
Thank you.
Bye.
All right. Talk to you soon. All right, you all. So now we're going to transition into, and this is, I'm just letting you know now, this is probably going to go over a little bit because, we're talking about some important stuff. And so I don't know if you noticed it or not, but, in my little acronym thing, I wanted to really spell out the word eighth because, in the Army, we're just taught that, using acronyms just helps people to remember things and it helps them to stick out. But I had to add the safety in there. And so it just didn't make sense that I added an S. So that's why I added health and safety. But these are very much topics that really should be handled separate from one another. But for the purposes of this town hall, I went ahead and just added them together. But we're going to be doing some supplement lives and things like that to talk about some of this stuff. But I just really want to focus on, let's see, where's my... Here we are. All right. So when we're talking about policing, okay, so I just want to just keep it real with everybody for a minute. I have been canvassing now. I think that we have talked to a little over 5,000 people in the 8th district, or attempted to. We've knocked on about probably a little over 2,000 doors. And one of the things that I do when I engage folks is to ask them, when I win the seat, what would you have me focus on? What would be the priorities, right? Because nationally, there has been outpour of support for reimagining police, reimagining community protection. Because of the recent deaths of Breonna Taylor, George Floyd, the list goes on and on and on. Mr. Jacob, it's just rightfully there has been an effort for us all to focus on how we're going to reimagine community protection so that is exactly what it is, community protection, so that we are protected. And so with that, there has been a task force that was created by the mayor's office called the Task Force for Reimagining Public Safety. And my next guest, I can bring her on. Hello, Sheba. Okay, so she's muted. Let's see. We got to get you off mute. Let's see.
I'm off mute. Hello.
There you are. You're off now. Yay. Hello, Sheba.
Hey.
So listen, I was just briefly just talking about how, just with with just the outpouring of support to really call for better for Black lives. There is a national, a global, and a local conversation just on reimagining policing. And so I know that you are on the task force. You are also a fellow board member on an organization that is working hard at just criminal justice reform and just making sure that people are protected. And so I just wanted to bring you on so that you can kind of tell us about what the task force is, because a lot of 8th District residents just don't even know that it exists or what's going on. And then just tell us a little bit about where you all are and some of your goals and what you hope to accomplish with the task force. Hold on, first, you got to, because I know you, everybody else doesn't know you, you got to also tell us who you are right quick.
Yes, I'm Sheba Williams. I am the executive director of No Left Turns. We do pre and re-entry work. I am also the co-founder of the Institute of Forgiveness, which is our juvenile justice piece that connects community and people with lived experience with youth who have incarcerated parents, youth who are experiencing school pushout, and youth who have been involved in the detention and diversion programs. I have a ton of jobs, but we're not going to get into that because we may not ever end. So those are the important things. Task force. The mayor put together a reimagining public safety task force that was brought together some amazing people in the community who do work in the community to figure out how we can rely on the police less, what we can do to change things and make them more safe for our communities, gives voice for people who are in the community and actively working with individuals to speak to the police and address policies like the use of force policy, how we reroute some calls from police that aren't necessarily police related calls, like mental health calls, substance use abuse, things like that, that police don't necessarily need to respond to with the mannerisms that police typically respond. So our groups are split into 3 different groups. One is about use of force, which I am one of the 3 co-chairs of. The other is about healing and community work. And the third is, I am going to forget, it's basically rerouting service calls to other areas in the city. So we've only been meeting about a month. The first 2 weeks were honestly just rules of engagement, introductions and things, because we didn't all know each other when we first got on there. And for the past 2 weeks, we have been meeting in our respective subgroups and coming together every other Friday, which you all can watch live on the city's website or on YouTube to see what we discuss, because it gets pretty heated in our subgroup discussions. We're kind of tame for the public, but we do get into like really heated discussions about community policing and how it has been and how we've gotten to this point thus far. You're muted.
Yeah. Okay, there I am. Can you hear me now?
Yes.
Okay, sorry about that. So I just wanted to say that I did watch the first presentation, and that presentation just on the history of policing in general and just how, the institution of policing in general just represented early on just a lineage of oppression and biased treatment to specific communities, specifically the Black community. And so they were able to kind of show us, a presentation of that. And it was really informative and really good for officers to be able to watch too, to be able to see why, sometimes they're receiving the brunt of some of the issues that have happened historically, And so one of the things that I am really big on right now, just in our community conversations, is asking certain questions. And one of them is like, how can we impact police structure? How is racist and abusive policing held accountable, right? Because you want to make sure that folks that are doing the right thing and officers that are abiding by the law and not putting, not having biases and things like that, are able to call out bad behavior, and that there's no, they don't get reprimanded, or there's no type of like shunning, or basically there's an environment for them to be able to call out bad behavior and then actions are taken on that. And so just making sure that we have a realistic way for our city to move forward regarding policing, because at the end of the day, we love the good work that officers do, right? The good work. We all have family members and friends and people we went to school with, and just officers that we interact with on a day-to-day basis that are doing amazing things in our community, in and around our community. But those are the good officers that need to be supported when they see and call out bad behavior and bad systems. And so, just wanted to put that out there. Feel free to continue with what you were saying.
So, full transparency, I am a person who does not really bite my tongue a lot. I am respectful, and I'm very mindful of everybody coming from different backgrounds. I have two cousins who are Richmond police officers. One is pretty much a rookie. She's only been on the force for a little while, and one has been on the force for about 15 years. So, right is right, wrong is injustice. If they are doing wrong, they should be held just as accountable. And I speak that, to them. That is no secret. Right now, when we're talking about protections for citizens, there is not a lot of protection. If you feel like an officer has harmed you or wronged you, you have to go to the police to file a complaint against the police. And from what we have seen historically, there is no relief. There are not a lot of substantiated claims of abuse when people file, and that is why a lot of people are in an uproar and are asking for reimagining. It's not realistic to expect the police who have this blue veil, who protect each other, through and throughout, to police each other. That's just unrealistic. So what the general public can do, you, me, anybody, we have a special session going on right now where there are tons of police reform bills that are being, questioned on. If you're not a person who likes to speak, you can submit written comment about what you feel about different things. There are hundreds of bills that have been submitted. What speaks to you? There's things like expungement, which we've never had in Virginia. Virginia right now is a state that does not offer expungement for people who were not convicted, nor people who are convicted. So right now, if you are arrested because somebody says you did a thing, you are arrested, you go to jail, you pay a bond if you want to be released most times, you pay for an attorney, you miss time from work to go back and forth, you miss time away from your family, you pay fines, court cost restitution, and then you're found not guilty. There is no compensation for that lost time or that lost energy, because they just say, hey, we saw you on a camera at work and we know that you couldn't have done this. It's dismissed. If you want to have that removed from your record right now, you have to go to the court. You have to pay for fingerprinting at the police station, which can be traumatizing if you've already been arrested unfairly. Then you have to go to the court and pay $96 or request a waiver, which requires like a pretty extensive financial background check as far as like putting forth like your resources and income and things to go before the judge and the prosecutor again. So the only people who are eligible for expungement right now are people who have not been convicted. There is no relief for people who have been convicted, but just
an arrest record, but you were found not guilty. There's no relief currently for that situation.
If you were found not guilty, you can apply for an expungement. But until you apply for that expungement, it is on your criminal background check. If you were convicted,
which is still a barrier to accessing employment, which is a barrier to access housing, which is a barrier to accessing just about anything. So
You're talking about your professional licensing. You're talking about being able to participate in things in your kids' schools. Sometimes you can't be a chaperone if there is a charge on there or like a pending charge. So it
or
takes
being
away so
being
many
banned from
things.
certain communities, being banned from going to see children in your community and things like that.
Yeah, and that's all based on something that you haven't been convicted of. So imagine what happens when you are convicted. But there are bills in the special session right now that are addressing things like expungement and police reform. I have been testifying all day on different bills. There was a specific bill that was trying to charge the members of the parole board if they agreed to release a person from prison and that person committed another offense. They wanted to have civil penalties for members of the parole board who are appointed, but they don't want to have civil penalties for police officers who use like force and they sign up for the job. So we spoke against that bill and it was killed in the Senate. I have been testifying for House Bill 5029, which is McQuinn's bill that says that if you are a police officer, and we're talking about good police officers or those police officers who are complicit in seeing use of force, seeing wrongdoing and not reporting it, they can be penalized. So I testified for that. I testified for some expungement bills. But you all can get involved. If these are things that you're passionate about and you know that we have been saying for years, there should be some relief for different things. Sign up to testify, sign up to submit written comment, speak to your legislators year round. Don't just wait until we're in special session, because guess what? You have less time to have their attention while they're in General Assembly and special session than you do year round. You can go to who'smylegislator.com to figure out who represents you in whatever district.
Betsy Carr, Senator Delegate Betsy Carr, and Senator Joseph Morrissey are ours, just in the 8th, just so y'all know.
Yeah.
So one of the things that I've been, like I said, we've been calling and talking to a lot of folks, and we asked them what their priorities are, what they should, what they want us to focus on. And I have a lot of actual our Richmond City police officers that live in my district, and some that support me, some that don't. But one of the things that I would say, most of the people who I talk to, they're really concerned with rapid gunfire in their neighborhoods. A lot of, some of the violent crime that's happening recently. Anytime a life is lost on Southside, especially a child's life, it's just devastation throughout the district. And so folks really want to work on, their thing is, we need more police. And so what I do to talk about that is just to talk about some of the things that I want to do to kind of help to focus on root causes to crime, and not just the Band-Aid afterwards. And so some of those things that I just want to kind of just mention here, and then I'll probably go into it. Like I said, we'll probably have to do another one of these to make sure we go into things. But just investing sufficient funds in organizations and networks that are embedded into communities to leverage existing community resources, grow new organizations, and ensure investments are strengthened rather than displace the established communities. Also building supportive infrastructure to administer funds and support relationship building between sources and the recipients of funds. This could include intermediaries, partner organizations, and designated agency divisions, and then documenting and communicating progress of results. Oh, is it? Oh.
You put your paper up.
Yeah, documenting and communicating progress and results. But like goals of making sure that there are groups in our communities that are doing really good work to, that focus on our youth and just community building and trust building. And I just don't feel like there's enough support for especially our youth to be able to have outlet. And there was something that struck me the other day. I think there was an NBA player that was talking about just the recent acts and things that were happening. And one of the things that struck me is he was saying that you can't be something you can't see. And so just ensuring that we're giving our youth and our young adults a fair chance at achieving whatever success looks like for them. And they can't do that if they're not exposed to certain things. So I'm just really big on making sure that we're doing that, providing youth and families with local mentors who have prior justice involvement, because that also, helps the justice involved with employment, but also they're able to tell the story straight from, a firsthand experience in an effort to help youth to not fall on those same paths. And so the other thing is, supporting locally identified public safety strategies. Work some of the recommendations that you all are going to be coming up with on the task force. And then supporting continuum of care with violence prevention, intervention, enforcement, and reentry services. And then also prevent youth system involvement by supporting alternatives to detention and confinement. And so those are things that I would be in support of. Also violence intervention programs. And those are the types of things initiatives that I would be wanting to fund and support, so that we're not asking our police force and our police officers to respond to every situation. And, and some of those things can have community supports. What do you think about any of those things that I just mentioned? I know I gave you a small amount of time.
So I want to encourage everybody who is listening and thinking about this. Prior to where we are today, 2020, we had programs for youth who were 14 to 21 to work every summer. We had Boys and Girls Clubs that had $5 memberships for the year. We had healthcare, throughout the community. We had community. I could leave my child with my next door neighbor if I needed to go catch the bus at 3:30 and my oldest kid didn't get home from work till 4 o'clock. We don't know our communities. We don't know our neighbors anymore. So a lot of where we are is lack of resources for things that lead up to not getting to that place where we have crime and need reliance on the police. So when we say the kids are home, COVID is rampant and it's keeping everybody in a place where everybody's home and everybody's going crazy. I got 3 kids that are almost grown and they still driving me crazy. Husband too. He is not exempt. But that leads to anxiety, unchecked mental health issues, because while we say, and we as women, we as strong women say, I'm good, I got it, I'm okay. Sometimes I have to shut down and say, I need a break. Yesterday was one of those days. Phone still rung off the hook, but guess what? I didn't respond to a soul until today. So there are things that are unraveling and happening, but history repeats itself. We used to have these resources. We used to have community centers that weren't so focused on basketball and football. There were arts. There were different programs for people who weren't necessarily into sports. There were, people were able to come around who had lived experience and guide the community and guide the kids. We don't have that anymore like we used to.
I want to bring up this another page in the insights report, just so that you can kind of see some of the things that I've been looking at. And if you notice here, just the same with our health outcomes, the same with our health outcomes, the same with our, it's almost like you can put the heat shield map with the redlining map and all the maps on them, and there's still these key areas. I want you all to see, where they have a on here shades where violent crimes, kind of sit around. And here we are, right here where my office is, 3501 Route 1. There's a huge, red area here. There's some other red spaces in and around the area, but it's just really interesting to show how, like I said, the intersections of how poverty areas, economically deprived areas, etc., continue to face the worst in pretty much all aspects of life. And it's just really unfortunate. And so this is why, it's important to me, we can pull that off now, that we really focus on, try to focus on more root causes. Is there anything else that you want us to know about and bring up? I know we are after 8 o'clock. The 8th District are prompt folks. They like things to be on time, but this is really important. I shouldn't have tried to push so much information into one town hall, but like I said, we're going to do a couple of supplement lives. And when we do that, we'll kind of go over some other things. But you tell me, is there anything else you want to talk to the people about, or things that you want to, how people can get in contact with you, etc.?
I am No Left Turns Inc. on everything, but the biggest thing that I want to leave you with is, one, we have a huge election coming up November 3rd. It's time for change. It's absolutely time for change. We have a lot of progressive people who are running, not because they want the fame and craziness of being a politician, but because they really care. Like, this is the first time in a long time that I see people who jumped into this and said, you know what, I've had enough and it's time. Get involved year round. Don't just wait until it's General Assembly time to reach out to your legislators, because guess what? They are responsible to respond to you year round, not just when they want your vote. When people come to you and they ask you to put a sign in their yard or they need a vote, tell them what your list of demands are. Tell them what it is that you need. Don't just let them come by and use you and take pictures and pass out hot dogs and say, oh, okay, I'll see you at the polls. And then when in November 4th, you can't get in contact with them anymore. I'm a firm believer in making sure that we talk about defunding the police and people say, oh, that's blasphemy, we shouldn't do that. We're talking about reallocating funds to resources that are necessary and needed for our kids to be able to grow and thrive in their communities. We're not asking for police to abuse us and take power away from us and trample on our rights. We're asking for police to do the protecting and serving or get the hell out of the way. And so far, it's not happening. That is what the conversation about defunding the police is about. It's not about taking away and stressing resources that are being stretched thin. We're talking about
I'll just be honest with you. The folks in the 8th District, they're not. That's the problem with those types of those terms and those hashtags and those movements, is that they're not reaching the end of, the communities. They're really, because I'm telling you now, they're not trying to hear that, they're not trying to hear anything about defunding their police department. There's, the 8th District residents have a really good relationship with the 2nd Precinct and the officers there. And so I have to try to, this is why this is important, so people can explain and understand that we're not talking about taking money away from good officers. We're talking about putting money into investing in root causes to crime, so that we're not policing it on the back end, if that makes sense.
Policing away a problem that shouldn't be met with resistance and violence. So what you want, you have to ask for it. Don't just sit there and say, I have a vote and I'm not going to vote because it's not going to matter. You don't have to just vote. You can run, you can serve on juries, you can be a notary public, you can get involved, go to school board, go to city council, and we're thinking about the guy up 95 who is living in a house that doesn't belong to him. But the fact of the matter is, our local elections are what matters most when we're talking about changing our right now. We're talking about changing our environments. So, do your part to make the change happen that you want to see right here at home.
That's right. Thank you, Shiva. Well, listen, I'm going to, like I said, after this, I'm going to put up the resources that our first speakers talked about. We thank you for your service. I know that there have been people who have kind of dipped in and out of the task force, for rightful reasons that they're committed to. But I just want to let you know that we're thankful for your service on that commission or that task force. And we look forward to great things that you all recommend. And I look forward to on city council helping to make those things a reality, because we definitely want to support our good officers and make sure that the bad apples are away from here, especially the 8th District. But I thank you so much. I'm going to go ahead and dip out and close so that we can, because there's a special versus battle that's happening right now that I'm sure that You and everybody else get off.
Sorry, y'all.
But I'm so thankful for you, and we'll talk to you soon, okay?
All right. Good night.
All right, good night. All righty. So you all, okay. So I was just want to close by saying that, that I am aware of the systemic and institutional issues that face our district. And we just want to make sure that you all know that it's critical that we use every opportunity and resource available to improve the overall health of residents in our district. I will be focusing on improving residents' ability to be healthier where they live, learn, work, and play. I know that individual health is connected to public health, and I will always be supporting well communities. And so as your city council representative, I will prioritize the following efforts. Number one, access to primary and mental health care facilities in and around the 8th District, which you all can see by my guest today. I'm already actively doing that before I even, get into the seat. Also, collaboration with the Richmond City Health District and Richmond Behavioral Health to seek out solutions and partnerships, because we know that access to those services is few, far in between here in the South Side. So my goal is just to increase access to resources on the South Side, whether that's in the form of a facility or what, but I'm willing to explore that and to help work on that. The other is to support the continued support for the continued maintenance of the VA McGuire Hospital, which sits in our district for our veterans, and also explore a partnership with them. I mean, there's no reason why, even though that they support veterans, why they can't be a great neighbor to the 8th District, and maybe we can collaborate on some health fairs and things like that to help get our residents the support that they need. And then also asset-based and comprehensive approaches to health and safety. Like I said, we're going to be focusing on making sure that our infrastructure is conducive to walking, biking, being active, and being safe. And so I know that the health of our neighborhoods is connected to the health of our families. So I am committed to supporting, highlighting, and introducing wellness and safety initiatives to us. And I will also be posting about the VCU Center on Society and Health. They did significant research that mapped out the life expectancy based on where you live. And then within the study, gaps in health were mentioned based on multiple factors. I will be seeking to incorporate these layered and interconnected factors through my vision of health and safety for the 8th District. So I just want to say thank you, thank you, thank you, thank you, thank you. This concludes our 6-part series, but we are coming back because we are going to do a town hall that is in totally in Spanish for our Latinx neighbors and Spanish-speaking folks. And then we're also going to, I'm committed since the first one on education, I make a promise to Rodney Robinson, and I can keep my commitments to the 8th District that we will be doing also a youth-centered, focused town hall just with our district's youth. So I look forward to doing those two, and then doing some supplement lives to just kind of talk about some of the things that were highlighted and some updates, because, kids are going back to school in next week, and we have other updates to education that we want to talk about. So thank you. You can contact me, as always, at 446-1029. That's the phone number. You can text me anytime, and then call me. Try not to call after midnight, but you can call me on that number, 446-1029. You can also visit my website, www.amyintheeighth.com. The website has my vision on all 6 key areas. And then we'll also be putting out some other information about some of my plans on some other things that aren't related to these 6 categories soon. So you can check out the website. You can join the A-Team. You can join the A-Team. You can connect with us as well as donate to the campaign, all on the website. And shout out to Eventful. If you or your organization has virtual town hall or any type of virtual needs, where you need assistance on having cool slides and all of the great things and the graphics that come up on the screen while I'm with you, please connect with me. I will connect you with Eventful, with George at Eventful. I'm so thankful for his support and their company's support for these town halls, their continued support. And that's going to be it for me, 8th District. There wasn't any questions or anything. Yeah, okay. So that's going to be it for me. You all enjoy Brandy and Monica on Versus, those of you who know what I'm talking about. And I'll see you in and around and about the district. Talk to you soon.